Welcome to Vitals and Veins, where we break down the real work behind patient care, built for medical assistants, phlebotomists, and EKG technicians, from students working toward certification to seasoned pros keeping their credentials current. This podcast is for those committed to doing the job well at every stage of their career. Let's get into it. Most healthcare workers know what exposure protocol is supposed to look like.
At least on paper.
Wash the area, report immediately, notify occupational health, follow the protocol.
Simple enough.
In theory.
But healthcare rarely happens in ideal conditions.
Exactly. Exposures don't usually happen during calm moments where everybody has time to stop and think clearly.
It's usually during complete chaos.
A busy shift, multiple patients, short staffing, alarms going off, somebody needing something immediately.
And then suddenly, an exposure happens, right in the middle of it all.
And what's interesting is that most healthcare workers do know what they're supposed to do next.
But knowing what to do and actually doing it are not always the same thing.
Especially under pressure.
Because people start negotiating with themselves almost immediately.
Oh, it barely broke the skin.
I'll report it in a little bit.
It's probably fine.
I don't want to slow everything down.
And suddenly, the gap between protocol and real life behavior becomes very obvious.
Because healthcare systems are built around humans working under stress.
And humans are complicated.
Very complicated.
So today, we're talking about why exposure protocols break down in real clinical environments.
Not because healthcare workers don't care.
Usually, it's the opposite.
People care so much, they start prioritizing everything except themselves.
Welcome back to Vitals and Veins. I'm Nichelle.
And I'm Kirsten.
Over the last few episodes, we've been talking a lot about sharps exposures from different angles. We started with the personal experience side of it. Then we talked about what a strong post-exposure response system should actually look like. And in the last episode, we focused heavily on perceived risk versus actual clinical risk.
Which I think is an important conversation because people really do interpret exposures emotionally first.
Absolutely. And understanding risk helps people navigate these situations with a little more clarity instead of just fear.
But today, we're kind of shifting into the real world behavior side of things.
Exactly. Because one thing healthcare does not struggle with is creating policies.
Healthcare loves a policy.
Healthcare loves a policy.
Following them consistently under pressure is where things get interesting.
And I think this is one of the biggest disconnects in healthcare safety conversations. A lot of education focuses on what people should do, but much less attention gets paid to why people often don't do it.
Especially when they technically know better.
Exactly. And I think that's important because most protocol failures are not happening because people are reckless or malicious.
Most healthcare workers are actually trying really hard to do the right thing.
But when they're trying to do the right thing inside environments that are fast, overstimulating, emotionally demanding, and constantly interrupted,
Us healthcare workers become very good at functioning in chaos.
sometimes too good,
Yeah, because eventually chaos starts feeling normal.
which can create dangerous normalization around things like fatigue, skipping steps, delaying reporting, or mentally minimizing exposures.
And people absolutely do mentally downgrade exposures.
Almost immediately sometimes. And I think shame plays a much bigger role in exposure behavior than people openly talk about.
Oh, I completely agree. Because a lot of healthcare workers immediately internalize exposures as personal failure.
Yeah, even though exposures can happen to very experienced hands, because protocols don't exist in isolation. People exist inside teams, departments, leadership structures, workflow systems. And if you've worked in healthcare for any length of time, you've probably seen the same policy produce very different outcomes depending on the department, the manager, and the culture around it.
And healthcare workers watch each other constantly.
They really do.
People know very quickly whether reporting exposures is genuinely supported or quietly discouraged.
And sometimes it's not even explicit. Sometimes it's subtle reactions, tone, annoyance, workflow frustration, people acting inconvenienced.
Or even comments like, well, was it even that serious?
Exactly. And over time, those little reactions shape workplace behavior,
Because humans adapt socially really fast.
especially in healthcare environments.
And honestly, I think newer healthcare workers are especially influenced by this.
Absolutely. New staff learn culture by observing long before they fully understand policy,
They watch what experienced people actually do.
not just what their training modules say.
For sure, exactly.
So, today, we're going to talk about why exposure protocols break down, why healthcare workers delay reporting, how workflow pressure changes behavior, how shame and normalization influence decision making, and what strong exposure culture actually looks like in real clinical environments.
Because honestly, good safety culture is about a lot more than having a binder full of policies somewhere.
Oh, much more. And one thing I hope this episode does is help healthcare workers realize that these behaviors are usually not random. They're shaped by systems, culture, stress, workflow, leadership, and even human psychology.
Which means improving safety isn't just about telling people, be more careful.
Exactly. It's about understanding how humans actually function under pressure. Before we continue, a quick note from the educational platform supporting this podcast. The phlebotomy certification exam tests more than what's in the textbook. Phleb Review bridges the gap with realistic practice questions and explanations that actually stick. When the stakes are this high, prep with the resource built specifically for your exam. Visit phlebreview.com today. So I think one of the biggest misconceptions around exposure protocol failures is that people assume it comes from recklessness.
Right, like somebody just didn't care.
Exactly. And most of the time, that's not what's happening at all.
Usually it's actually the exact opposite.
Yeah, most healthcare workers are trying to manage 10 competing priorities at once,
And they're usually prioritizing patient care over themselves in the process,
which sounds admirable on the surface.
but can create really unhealthy safety behavior underneath.
Exactly. Because when an exposure happens, a lot of healthcare workers don't immediately switch into, I need to stop everything and take care of this.
For sure, a lot of people think I just need to finish this first.
Yes. Finish the blood draw, finish passing meds, finish stabilizing the patient, finish charting, finish turnover.
Or even just let me get through this next 10 minutes.
And honestly, I think healthcare workers become conditioned to delay their own needs constantly.
Absolutely. Like you said before, bathroom breaks, eating, hydrating, sitting down.
So it's not surprising that exposures get mentally pushed down the priority list, too.
Especially if the exposure doesn't immediately feel dramatic.
Oh, yes. And this is where people start negotiating with themselves internally.
Oh, it probably barely broke the skin.
It's probably low risk.
I'll report it later.
I don't want to slow down the unit.
I think a lot of healthcare workers underestimate how quickly they start rationalizing things under stress.
Very quickly. Now, suddenly, there's paperwork, questions, occupational health, possibly labs, maybe follow up.
And depending on the workplace, people may already associate reporting with frustration before they even start.
Which is a huge problem culturally, because if the reporting process feels punitive or inconvenient, people become less likely to engage with it.
Especially during chaotic shifts.
Oh, yeah. I think people outside healthcare underestimate how mentally overloaded healthcare workers already are most of the time.
Completely. You're constantly switching tasks.
Constantly.
You're remembering medications, patient interactions, time sensitive tasks, safety checks, documentation.
And interruptions every 30 seconds.
Exactly. And then an exposure happens inside all of that.
Right? And this is precisely why I think healthcare safety conversations sometimes become too simplistic because it's easy to sit in a training room and say, always report immediately.
But real healthcare environments are so messy,
Very messy.
and human behavior changes under pressure.
Exactly. Hey, which is why good safety systems have to account for actual human behavior, not idealized behavior.
That's such a good point. Because healthcare policies are often written as if people are functioning under calm, perfect conditions,
And they almost never are.
especially in high volume environments like clinics.
Yeah. And I think this is one reason protocol failures are often systemic rather than individual.
Because behavior doesn't happen in isolation.
Exactly. People respond to the environment they're functioning inside of.
And if the environment constantly reinforces keep moving, don't slow down, don't create extra work,
People start applying that mindset to safety behavior too.
even subconsciously.
Oh, yeah. I think a lot of healthcare workers don't even realize they're doing it,
No, I agree. I think a lot of this becomes automatic over time
especially for experienced staff.
because eventually chaos starts feeling normal.
And normalized chaos is dangerous because people stop recognizing unsafe adaptation as unsafe.
It just becomes this is how healthcare is.
Exactly. And that's where many safety systems quietly start breaking down, not because nobody cares, but because people adapt to pressure in ways that slowly erode consistency over time.
And those adaptations often feel efficient in that moment,
Yeah, until something goes wrong.
which is usually when people finally stop and realize how much unsafe normalization had been happening already.
Exactly. And that's one of the biggest themes underneath this whole conversation. Protocol failures are usually more about human systems under pressure than individual bad intentions.
Healthcare workers are humans functioning inside stressful systems.
And good safety culture has to start from that reality, not pretend it doesn't exist.
One thing I've noticed over the years is that most healthcare workers already know what the protocol says. The problem usually isn't knowledge, the problem is implementation. It's the difference between knowing the correct answer during annual training and trying to apply that answer during a busy shift when patients are waiting, phones are ringing, and five other things need your attention immediately. That's where safety systems either support people or fail them.
And honestly, one of the biggest pressures shaping all of this is time itself, because time pressure changes healthcare behavior in ways people don't always recognize in the moment.
Especially during busy shifts where everything feels behind before the day even starts. I honestly think time pressure changes healthcare behavior more than almost anything
I completely agree. And what's interesting is that people don't always realize how much pressure is influencing their decision making in real time.
because once you've worked in healthcare long enough, functioning under pressure starts feeling normal.
Exactly. People adapt to environments that are constantly overstimulating.
And eventually, your baseline becomes multitasking, interruptions, running behind, and trying to recover time all day long.
And exposures happen inside that environment, not calm, controlled moments.
Almost never in calm moments.
No. Usually somebody's waiting, something's overdue, someone else needs help, a patient is upset, and the phone is ringing.
Or you're already mentally trying to catch up from being behind for the last 2 hours.
Exactly. And I think one thing healthcare workers struggle with emotionally is that patient care always feels urgent.
For sure, it always is urgent.
So when an exposure happens, there's often this immediate internal conflict between I should report this and I can't stop right now. I remember times in clinic where something would happen that absolutely deserved my attention, but I was already mentally juggling five other things. Patient waiting, another provider needed something. There were charts piling up. Even when you know the right answer, it can feel surprisingly difficult to hit pause on everything else.
And people start thinking if I leave to deal with this, everyone else is drowning.
Yeah, even though exposures absolutely deserve the immediate attention.
Right. Intellectually, people know that.
Workflow pressures changes priority very quickly.
And truly, healthcare workers get very used to sacrificing their own needs first.
Yes, so I think that becomes so normalized that people stop noticing that they're doing it.
Yeah, exactly. Eventually, sacrificing your own needs stops feeling unusual,
And that's when it becomes really easy to tell yourself you'll deal with an exposure later.
which can turn into hours later.
Exactly. And one thing I think is important here is that delay doesn't always happen because somebody consciously decided, I'm not reporting this.
For sure. A lot of times it happens gradually.
Yes. People mentally push it down the priority list temporarily.
And then the workflow just keeps consuming everything.
Yep, exactly. And eventually, enough time passes that now the person feels awkward reporting late. Exactly. And I think that this is where workflow culture becomes really important because some environments unintentionally reward unsafe adaptation
And eventually people internalize that slowing down equals weakness
or inconvenience.
or not being a team player.
Exactly. And that mindset becomes really dangerous around exposure reporting,
Even though every safety training in the world says they should.
right? But culture almost always influences behavior more powerfully than policy.
Especially repeated everyday culture.
Absolutely. Especially in stressful environments where people are trying to figure out what's normal.
And some unsafe behaviors become normalized so deeply people stop recognizing them as unsafe.
I completely agree,
If something feels complicated, people delay it.
especially under stress.
And healthcare workers are already operating under chronic stress most of the time.
Exactly. Now, something else I think contributes to this is productivity culture in healthcare.
Oh, definitely.
A lot of healthcare environments are heavily metrics driven now. Efficiency, turnover times, patient load, productivity expectation. And unfortunately, safety behaviors sometimes get psychologically categorized as slowing workflow.
Yeah, even when they're critically important.
Exactly. And that's dangerous because humans adapt incredibly well, even to unhealthy environments.
Sometimes, especially to unhealthy environments.
Yes. And over time, those adaptations become culture, which means new staff walk into environments where unsafe normalization is already established.
And then the cycle repeats.
Exactly. Which is why improving exposure reporting isn't just about telling individuals to do better.
It's about building systems where safe behavior is realistically possible under pressure.
That's keyword realistically possible under pressure. I think that distinction matters enormously because healthcare workers are not failing in a vacuum.
They're responding to environments, workflow, and staffing realities all at once.
And all of that affects behavior, whether people consciously recognize it or not.
Exactly.
I think healthcare sometimes underestimates how much behavior changes when people feel like they're running behind. Under time pressure, people naturally start simplifying decisions. They prioritize, they defer, they delay, and sometimes they convince themselves they'll come back to something later. That's not unique to healthcare, it's just human behavior. The question becomes whether the system is designed with that reality in mind.
I honestly think embarrassment is one of the biggest reasons exposures go underreported.
I completely agree. I don't think healthcare talks about that enough
No, because exposure education focuses on protocol.
and not the emotional reality afterward.
Exactly, because a lot of healthcare workers immediately internalize exposures as personal failure.
Almost instantly.
Like, how did I let that happen?
I remember after my own exposure, one of the first things I felt wasn't fear, it was frustration with myself. Looking back, that's interesting because exposures happen to experienced people all the time. But in the moment, it still feels personal, and I found myself thinking I should have been more careful. But emotionally, people still often interpret exposures as evidence that they were careless or incompetent.
I think healthcare culture sometimes reinforces that unintentionally.
Exactly. Healthcare workers are extremely sensitive to social tone during stressful moments. And I think that social pressure changes behavior way more than organizations sometimes realize.
For sure, because people remember how those moments felt.
And those memories shape future reporting behavior more than anything else.
For sure, and healthcare workers talk to each other constantly about this stuff afterwards,
All the time.
especially around minor exposures.
Minor in quotations.
Mhm.
Exactly. And honestly, I think shame contributes heavily to minimization behavior too.
Absolutely. People start convincing themselves it wasn't serious enough to report.
When sometimes underneath that thought is, I don't want people judging me.
Exactly.
Sadly, shame is such a powerful emotion because it pushes people toward hiding behavior.
For sure, we beat ourselves up.
Mhm.
Humans generally do not become more transparent when they feel ashamed because healthcare environments often reward composure over openness.
Yeah, exactly. What I think one of the healthiest things organizations can do is normalize supportive response instead of shame responses.
I completely agree because exposures are already stressful enough without people feeling embarrassed on top of it.
And eventually, people start protecting themselves socially instead of following protocol consistently.
Which is really dangerous long term.
Because now the workplace culture quietly shifts from reporting exposures to only reporting exposures that seem serious enough to justify the inconvenience.
I really don't think people can be objective enough during these stressful moments to make those decisions reliably.
Exactly. And that's why systems exist, not because humans are bad, but because humans are human
And stress changes behavior.
every single time. One of the clearest places you can see culture shaping behavior is how healthcare workers talk about minor exposures.
Because minimization culture in healthcare is very real. I think healthcare workers normalize things incredibly fast.
Dangerously fast.
And I think exposure culture is one of the clearest examples of
I
that.
agree. Yep. Because a lot of healthcare workers start mentally minimizing exposures almost immediately,
Especially if the injury seems small.
right? It barely broke the skin.
There wasn't much blood.
It was probably nothing.
I've had worse.
In reality, I think people sometimes don't even realize they're minimizing,
No, I agree. I think it becomes automatic over time.
especially in environments where exposures are common enough that people stop reacting strongly to them.
And healthcare workers absolutely compare experiences too.
Constantly, and sometimes those comments are meant to reassure.
But they can also unintentionally normalize underreporting.
Yeah, exactly. Because now the person starts thinking, maybe I'm overreacting.
Or maybe this doesn't count enough to bother reporting.
Yes. I think experienced healthcare workers sometimes become desensitized in ways that they don't fully recognize,
For sure, completely.
including unsafe situations sometimes.
Exactly. And that desensitization can quietly influence newer staff too.
A lot, because new healthcare workers are constantly watching how experienced people react.
They watch what gets reported, what gets ignored, what people joke about.
But sometimes it also becomes a way of emotionally minimizing safety concerns.
Exactly. Like, well, welcome to healthcare.
Or it happens to everybody eventually.
And while there's truth underneath that,
It can unintentionally make unsafe adaptation feel normal.
exactly. I think normalization is one of the most dangerous psychological processes in healthcare generally.
Yeah, I completely agree. Because humans adapt to repeated exposures incredibly quickly,
Even unhealthy exposure.
right? Especially unhealthy exposure sometimes.
And eventually, people stop recognizing dysfunction because it becomes routine.
Yep. And I think this happens a lot around workflow shortcuts too,
Definitely. People start rationalizing. I've always done it this way. Nothing bad has happened before, or it only takes a second.
which is dangerous because humans often confuse familiarity with safety.
That's such a good way to describe it.
One thing that's interesting about normalization is that it rarely feels dangerous while it's happening. It usually feels practical, efficient, reasonable. And that's what makes it difficult to recognize. Most unsafe adaptations don't start with someone deciding to ignore safety. They start with somebody trying to make it through a busy day. Then those adaptations get repeated, and eventually they become part of culture.
Another thing I think healthcare workers struggle with is that repeated safe outcomes can create false reassurance.
Exactly. If somebody takes shortcuts repeatedly without immediate consequences, eventually the shortcut starts feeling safe.
Even if the actual risk never changed.
I absolutely think that this is how underreporting culture slowly develops,
Yeah, not through one giant decision.
but through repeated tiny moments of minimization.
Yeah, exactly. Small exposures get dismissed, minor incidents get joked off, reporting delays become normal
And eventually the workplace culture quietly shifts.
without anyone formally deciding it should.
Exactly.
Because if newer staff repeatedly see experienced workers minimizing exposures,
They start assuming that the competent healthcare workers do.
exactly, and then the cycle keeps reinforcing itself. And if an exposure doesn't feel urgent emotionally,
It gets mentally downgraded.
even if it still deserves evaluation, humans are very good at convincing themselves something is probably fine when acknowledging it feels inconvenient or stressful.
Especially when workflow pressure is already high.
Yes, true. And this is one of the reasons exposure safety needs consistency because individual emotional interpretation is too variable.
Exactly. Which is why healthcare workers shouldn't have to independently determine whether an exposure deserves reporting based purely on instinct.
That's what structured evaluation systems are for.
Also, one of the biggest problems I see with minimization culture is that it often sounds reasonable in the moment
Yes, and that's what makes it so dangerous.
because the internal dialogue usually sounds practical.
Not reckless.
Exactly. I don't want to create extra work. It's probably low risk. I'm sure it's fine.
Exactly. One of the healthiest shifts healthcare environments can make is moving away from, does this seem serious enough, toward, was there an exposure event that deserves evaluation?
That's such an important distinction.
Because structured consistency is safer than emotional self assessment.
Especially in environments where stress constantly distorts perception.
Exactly. A huge part of whether minimization culture grows or gets interrupted comes down to leadership and workplace response.
Because people pay very close attention to how organizations react when something actually goes wrong.
Mhm. I think, honestly, that one of the clearest indicators of healthcare safety culture is how organizations respond when something goes wrong.
Not during orientation,
Exactly. Not during annual modules, not during policy meetings, and not during safety week presentations.
during the real life moments.
Yes. One dismissive response can influence reporting culture for a long time afterward. Strong safety culture should reduce hesitation, not increase it. Leadership tone matters enormously because managers and supervisors model emotional response for the rest of the team. I've worked in environments where something went wrong and the first response was frustration instead of support. What people in leadership sometimes don't realize is that everyone is watching those moments, even people who weren't involved. Staff learn very quickly whether transparency is going to be supported or punished. If leadership responds calmly and professionally, that emotional tone spreads outward.
And if leadership responds with frustration or blame,
That spreads too.
very quickly,
I think one thing healthcare organizations sometimes fail to recognize is that policy alone does not create behavior.
culture creates behavior.
Exactly. You can have perfect policies on paper.
But if staff feel punished for using the system, the policy stops functioning the way it's supposed to.
Exactly.
Now, something else I think matters a lot is operational support.
Absolutely. Because even workplaces with good intentions can unintentionally create barriers.
Yes, especially if reporting systems are confusing or difficult.
Yes. If staff have to track down multiple people, repeat the story, fill out multiple systems, or leave the floor for long periods.
People start associating reporting with stress and disruption.
Exactly. So friction changes compliance in every system. Healthcare workers are not immune to human psychology.
Additionally, I think organizations sometimes unintentionally create mixed messaging too.
Completely. On one hand, always report exposures immediately.
But on the other hand, workflow pressure makes people feel guilty for stepping away,
Exactly. And humans tend to follow the emotional reality of environments more than the written expectation.
especially under stress.
Yeah. And this is why leadership consistency matters so much because healthcare workers watch what leaders actually prioritize operationally.
Not just what they say they prioritize,
Exactly. And over time, people adapt behavior accordingly.
which is honestly how unsafe culture quietly develops.
Not through one dramatic failure, through repeated small compromises becoming normal.
Exactly.
The goal is not creating environments where mistakes never happen. The goal is creating environments where people feel safe responding appropriately when they do.
And silence is dangerous in healthcare systems.
Very dangerous. Now, something else I think is important here is that leadership behavior influences newer staff enormously.
Oh, definitely. New healthcare workers watch everything.
Everything: how exposures are handled, how mistakes are discussed, and whether people are treated respectfully.
Whether safety feels genuine or performative.
Exactly. Strong safety culture should make the safest behavior feel like the easiest behavior, not the most socially uncomfortable one.
That's such a good way to put it.
Because humans consistently move toward environments that reduce friction and social threat.
Especially under stress.
Yes, exactly. I think one of the healthiest shifts organizations can make is viewing exposures not as personal failures.
But as system events that deserve structured response and support.
Precisely. Because the moment healthcare workers start feeling punished for transparency,
Transparency starts disappearing.
and once that happens, safety culture erodes very quickly. So, the good news is that strong exposure culture is very achievable when organizations intentionally build for it.
And you can feel the difference almost immediately in workplaces that genuinely prioritize safety well.
And I think after talking about all the ways exposure culture can break down, it's important to talk about what good culture actually looks like too.
Because honestly, you can feel the difference immediately in healthy environments.
Yes, immediately. And I think that's something healthcare workers recognize very quickly once they've experienced both.
Oh, absolutely. A good environment feels completely different during stressful moments.
And good reporting culture also feels operationally smoother.
Definitely. The process feels clear instead of chaotic.
Yep, people know who to contact, the workflow makes sense, communication is consistent.
And staff aren't left feeling like they're inconveniencing everyone around them.
Exactly, because honestly, one of the biggest barriers to reporting is that friction.
Absolutely. If reporting feels confusing, time consuming, or emotionally exhausting, compliance drops.
Every single time. You'd not expect this, but I think some organizations underestimate how important operational simplicity is for safety behavior. You think they'd know that.
Yeah, especially during stressful shifts.
Exactly. Humans function differently under pressure,
And healthcare workers are already cognitively overloaded most of the time,
right? So, good systems reduce unnecessary complexity whenever possible.
which honestly benefits everyone,
Everyone.
especially in hierarchical workplaces.
Absolutely. And healthcare is often very hierarchical. One thing I think about a lot is the tissue pin process I talked about in an earlier episode.
Oh, the specimen marking process?
Yeah. So the lab had a safety concern with the way tissue pins were being handled, and a solution was proposed that would have eliminated the need for them entirely. The change wasn't received well by some, and their response wasn't about whether it was safer, but that it would take a little more time during the procedure.
Which is a common tension in healthcare.
Exactly. Nobody was intentionally choosing an injury. Nobody wanted anyone to get hurt. But it's a good example of how workflow efficiency can sometimes end up competing with safety measures. And when those decisions happen in hierarchical environments, frontline staff don't always have much influence over the outcome.
Even when they're the ones carrying the risk.
Exactly.
Looking back, what stands out to me about this situation wasn't that anyone wanted to get hurt. Nobody did. The challenge was that the discussion wasn't really about injury risk anymore. It had become a discussion about workflow, time, efficiency. And that's where a lot of healthcare safety decisions become complicated. Because safety interventions almost always require something: a few extra seconds, an extra step, additional documentation, additional communication. And when healthcare systems are already under pressure, those extra steps can start feeling expensive operationally, even when they're valuable from a safety standpoint.
Now, another thing I think healthy environments do well is consistency.
Yes. Either reporting is supported.
Or reporting creates problems
Exactly.
because the strongest healthcare safety cultures are not the ones pretending exposures never happen.
They're the ones that respond consistently and supportively when they do.
And that's one of the biggest mind shifts healthcare needs generally, moving away from who messed up toward how do we respond safely and constructively now.
Which honestly creates safer behaviors long term.
Completely. If there's one thing that keeps showing up throughout this conversation, it's that protocol failures are usually more predictable than they seem. When people are overloaded, interrupted, short on time, uncertain about expectations, and working inside systems with friction, behavior changes. And that's not a character flaw, it's a system reality. And recognizing that reality is often the first step toward building safer environments.
So, after all of this, I think the biggest question becomes what should healthcare workers actually take away from these conversations in real practice?
Because understanding the problem is important, but understanding how to move through it matters too.
Mhm. If organizations treat every protocol breakdown like a personal failure,
People stop being honest.
exactly, and honesty is essential for safety systems to function. Now, another huge takeaway for me is consistency.
Yes, because healthcare workers should not be self determining whether an exposure counts based on stress or instinct in the middle of a chaotic shift.
Exactly, that's what the system is made for.
And like we have touched on already, humans are not objective when they're tired, embarrassed, overwhelmed, or emotionally activated.
Not at all, which is why consistency matters more than emotional interpretation.
Far too easily, minimizing exposures become really dangerous over time because it usually develops gradually.
Completely. Unsafe culture almost never appears all at once.
It develops through repeated normalization.
Tiny compromises repeated consistently.
People watching each other, adapting socially, absorbing behavior.
Exactly. Healthcare workers underestimate just how much they influence each other sometimes.
Especially experienced staff.
100%. Newer healthcare workers learn culture by observation long before they fully understand policy.
Yes, they watch what gets reported, what gets ignored, what people joke about, and what leadership reacts strongly to.
Exactly. Which means every interaction reinforces something.
Which means leadership culture directly influences reporting culture, whether organizations realize it or not.
Yes. Now, one thing I keep coming back to throughout this entire conversation is that healthcare systems are built around humans functioning under pressure.
Not robots.
Exactly. Humans get tired, humans get overwhelmed, they respond to social pressure, and humans don't always make perfect decisions when they're under stress.
For sure. And pretending those realities don't exist usually just creates unsafe systems.
Exactly. Strong systems account for human behavior realistically instead of assuming perfect behavior all the time. So I think healthcare workers deserve systems that make safe behavior easier, not harder.
Especially in environments that are already emotionally and cognitively demanding.
Yes,
I think conversations like this help people realize these situations are often much more human than they initially seem.
exactly. Healthcare workers are often trying to function professionally while managing stress, uncertainty, workflow pressure, social pressure, and emotional reactions all simultaneously.
That's a lot for any person.
It really is. I think the goal should never be perfection. Healthcare is too human and too complex for that.
The goal is creating systems where people can respond safely, honestly, and consistently under pressure.
Exactly. Protocols are usually easy to understand on paper. The hard part isn't usually knowing what to do, it's doing it in the middle of a busy shift while under pressure with a dozen competing priorities pulling your attention somewhere else.
People are the complicated part.
And healthcare systems are built around people functioning under stress every day.
Which means culture matters just as much as policy.
Maybe even more sometimes.
Honestly, probably more.
Probably, yeah. Thanks for listening to Vitals and Veins.
The podcast where we talk about the real work behind healthcare, not just the polished version.
Protocols are usually easy to understand on paper. What's harder is following them in the middle of real life. During busy shifts, during staffing shortages, during interruptions, during stressful moments when attention is already divided. That's why strong safety culture isn't built by asking people to be perfect. It's built by creating systems that make the safest action the easiest action. Because when safety depends on perfect human behavior every single time, the system is already vulnerable. But when the system supports people realistically, safety becomes much more sustainable.
And in the next episode, we're going to shift slightly to talk more specifically about what actually prevents Sharp's injuries in real clinical practice.
Not just what policy says, what actually works operationally.
Because prevention is about much more than telling people to be careful.
Especially in environments where pressure and workflow constantly influence behavior.
Exactly. Thanks for being here with us.
Until next time, this has been Vitals and Veins.